This video has been made to introduce PALEO, a clinical trial for people with cancer of the esophagus that has spread to other parts of the body. The PALEO Clinical Trial is testing the idea of using a balanced combination of radiation, immunotherapy and chemotherapy. A cancer can start in one place, like in the esophagus, but unfortunately for some people, the cancer often spreads to other parts of the body before it is found, and often at the same time that it has started to cause symptoms. Surgery to remove the cancer is not useful when the cancer has already spread, but treatments like radiation, chemotherapy and immunotherapy can help some people. 2 chemotherapy drugs are used in the PALEO trial, carboplatin and paclitaxel. These are very well-known medicines used for many cancers. The immunotherapy drug used in PALEO is durvalumab, also called Imfinzi, which is used in lung cancer and has been tested in many other cancers. When we try to combine cancer treatments together, sometimes it is hard to get the balance right, as the side effects are too much for some people. Using just enough of each treatment might make the treatment easier to take, and more people with esophageal cancer might be helped. That's the idea behind the PALEO Clinical Trial. The radiation treatment is given for a short time, and the chemotherapy is only given twice. Radiation is first aimed at the cancer in the esophagus, but taken only for 10 treatments over 2 weeks. Chemotherapy is taken at the same time as the radiation in small doses, and again only for the first 2 weeks. Immunotherapy is also started early. These treatments together are hoped to quickly shrink the cancer in the esophagus and make eating easier. One more small dose of radiation can be given at 7 weeks, aimed at a spot of cancer that has spread to another part of the body. And immunotherapy can also be taken every 4 weeks for up to 2 years. The side effects of these treatments are described in detail on the participant information and consent form. A clinical trial is the best way to test new treatments for cancer. Taking part in a clinical trial is voluntary. You don't have to take part, and you can change your mind at any time. Whatever you choose will not affect your care. Talk to your cancer doctor about your treatment and whether this clinical trial is right for you. Ask questions about anything you don't understand or want to know more about. Before deciding to take part, you might want to talk about the PALEO trial with your relatives, friends or your family doctor. To learn about the trial in detail, please read the full participant information and consent form. It explains the tests and treatments involved. Please read this carefully. If you decide to take part, you'll be asked to give your permission by signing the consent form. If you choose to take part in the PALEO trial, the study team at the hospital will first check that the trial is right for you and that you fit the clinical trial. You'll be asked to have x-rays and scans to check how the treatment is working. These scans are done before each treatment starts, then every 6 weeks for 6 months, then every 12 weeks. A dietitian will check on you regularly as well to see how you are eating and to see if the trial treatments have helped you eat better and gain weight. And as in usual care, there will be regular blood tests and clinic reviews by your study doctors throughout the trial. There are some activities that are part of the PALEO trial that are extra compared to taking usual treatment. First, we will ask your permission to contact the pathology lab to save the sample of the biopsy that was used to diagnose the esophagus cancer. Second, we will ask to take extra samples of your blood. During the trial, we would ask you to donate an extra 24 ml of blood, just over a tablespoon, on 6 occasions during your treatment, which will be stored for future research. These tissue and blood samples will be used in the future to learn more about your cancer and how the treatment worked for you. Finally, we will ask you to complete some short surveys at various times during the study to learn about your symptoms and quality of life. Thank you again for your time and for considering taking part in the PALEO trial. Please read the full information sheet and speak with your cancer doctor. Again, taking part in a clinical trial is voluntary. You don't have to take part and you can change your mind later. Thank you.